Hello, and welcome to another Rush Generations Health Education Lecture. Rush Generations is delighted to be your source of information, resources, and health promotion programs that help maximize your well being and good health as you age. Today is Wednesday, April 24th, 2024, and I am Danelia Mitchum, licensed clinical social worker within Rush Generations. I'll be your moderator for today's lecture titled Medication Safety. We're delighted to have with us one of our esteemed Rush colleagues joining us today to speak about this important topic. Before I introduce her, I'd like to first thank our producer, Hannah Weitzman. As she normally does, Hannah will be helping us to manage the chat and other key aspects during this event so that we can all have a great discussion. As you know, we are live streaming this lecture via our YouTube channel, where we have dozens of other health education lectures that you can always refer to. So please feel free to let family, friends, colleagues know about our channel and any of the lectures that we've offered so that they can also benefit from the valuable information that our speakers offer every other week through Rush Generations. We use the video platform Zoom, which also allows us to host a good number of people who join us via phone. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to today's presenter. And for those of you listening to the discussion via phone, you will also have an opportunity at the end to unmute your audio so that you can ask your questions. We greatly appreciate you joining us today. Please remember that the information offered here is for general information purposes only, and that for situations specific to you or someone close to you, we encourage you to always seek additional professional advice so that your specific needs are met. Without further ado, now I'd like to introduce Dr. Kavya Parasa. Dr. Parasa is a geriatric medicine fellow at Rush University Medical Center. Dr. Parasa is originally from India. After completing medical school, she pursued internal medicine. She then completed a geriatrics fellow due to its applicability to multiple healthcare settings. She particularly enjoys the wisdom her patients bring to the table. Outside of work, Dr. Peraza likes to play Indian classical violin, travel, run, and bike on Chicago's Lakefront Trail. Thank you so much, Dr. Peraza, and I will turn it over to her.
Thank you so much, Dee, for welcoming me. Hello, everyone. I'm Kavya, and I'm one of the geriatric fellow, like Dee was mentioning, and I'm very excited to present this lecture today. I'm going to start sharing my screen. All right. I hope everybody can see this. Dee, can you confirm?
Yes.
Awesome. So without taking too much time, I'm going to move forward and talk about what we are going to do today. So the lecture today, as we were talking about, is about medication safety. And today's agenda that I want to really focus on are a few things. I would like to start with talking about a few of common medical conditions a lot of our older adults experience and are dealing with. I would like to talk a little bit more into some of the common medication guidelines. This is all been published all over NIH, and I have pulled data from there to give you specific guidelines. And a little bit about how do you manage your medications at home. And I want to add on something, a very popular topic of supplements. And we'll move forward with our first one. So common medical conditions. A lot of these medical conditions are very prevalent in our older adults and also in a lot of our general population. And the common ones that I put in here are quite used to a lot of our patients to remember. You may have known them by their medical medical terms, but I still put it in some of the common language as well. So hypertension is high blood pressure. Diabetes is when you have your high blood sugar. COPD or asthma are common lung conditions for which you might be using inhalers or a nebulizer or some medications, pills as well. Chronic pain is a very common problem a lot of people experience, and it especially gets a little bit worse when you're getting older. Back pain, knee pain are some common ones, and also a specific cancer-related pain for which we as physicians give a lot of specific guidelines for using medications to control that pain and keep that pain in check. GERD is also called gastroesophageal reflux disease, a medical term for it, but in common language we call it acid reflux, and a lot of us take medications for it. And another one is congestive heart failure. A lot of my patients come in with knowing this term, that they have congestive heart failure. It's important to know what that means. So definitely ask your doctors when you are diagnosed with this disease and what this means to you and how you're going to manage it with your medications. In simple terms, congestive heart failure is when your heart is not functioning at its appropriate level, and it's functioning slower. That's the simple way to understand it. And a lot of our patients are taking medications for it to manage it because this is a chronic condition and we need to manage it over a period of time. Saying all these, the reason why I put in these medical conditions is we as physicians have been prescribing medications for these specific conditions, and they are important to take. They are very needed to be taken on a regular daily basis. And you need to have an understanding that if you have any of these diseases, it's important to keep an eye on your medications and talk to your doctors and how important it is to take them, not stop. The second part of our lecture is a detailed talk about how to take your medications safely. So when I see a patient in the clinic or in the hospital, and if they tell me that they are taking medications, I have to organize myself in my mind to understand and remember the medications that they're taking and analyze that. So one way for me, I do it is to break them down into what are the types of medications they're taking. And I think this is a very easy way for anyone to categorize your medications. First one is your prescription medications. These are the medications your doctors are prescribing you. And you have to go to the pharmacy and pick it up. So that's the prescription ones. And the second one is over-the-counter medications. These are the ones that you can buy over the counter, but you have to go to the pharmacy to buy them. Examples of these over-the-counter medications would be your antihistamines like Zyrtec or Benadryl, your cough or cold medications like NyQuil, Dayquil, your medications for your, when you have stomach upset, like Pepto-Bismol or Gas-X or Tums, and laxatives. These are the medicines that we can buy over the counter without a prescription, but you might be taking them maybe once in a while or maybe more frequently than that, and it's important for you to bring it to the doctor and tell them that, hey, I'm taking these as well on top of the prescription medications. And then to add to that is an important component of supplements. It is very important for us as physicians to keep to keep asking our patients, like, hey, what medications are you taking? What supplements are you taking? To specifically direct that question. And it's also quite important for you guys to bring it up to your physician when you see them in the clinic, especially. Doctor, I've recently started taking these supplements because I've read somewhere this is going to help me with this. And whatever your reason is to start taking your supplements, definitely bring it up to your physician. Definitely talk to them if it is safe to take it, or are they going to interact with your medication, other medications, or what dosages you want to take it if they have any idea on that. So those are your types of medications. I would really encourage you all to categorize them, have them separated this way in your mind, and also when you're filing them or making a list. So that way you know what is going into your body, right? So let's talk a little bit about prescription medications. So prescription medications are the ones that we prescribe as physicians, prescribe you to our patients, you guys. And when you are started on the prescription medication, new prescription medication, it's very important for you to understand what this medicine is doing to your body, what this medicine is going to help you with, and what are the side effects from it. So that's a simple another word that we use on top, just not about knowing your medical problems, but also knowing your medications and what you're taking. All of this will be combined, and we call a word called health literacy, which means how much understanding you have about your health, about your medical problems, about your overall goals in life in general. So what do you ask your doctor when they prescribe your medication? So I'm going to give you an example. For example, you're recently diagnosed with high blood pressure, which is a very common diagnosis. As we get older, our arteries get stiff and our heart starts functioning a little differently. And that might predispose us to get high blood pressure. And it's very common for your doctor to talk to you and like, hey, let's do some diet changes, let's use your salt and all these things. And I also want to start you on a medication to help you get the blood pressure lower. The common medication we start our patients on is called a diuretic in medical terms, or it's in simple terms, it's called water pill. And this medication, your doctor is starting it on you, and these are the following questions you need to ask them when they start it. What is the name of it, and why am I taking it? What medical condition is it going to treat? It's important to know the second question, because some of your medications that you're taking might be treating 2 to 3 different diseases and 2 to 3 different problems. And knowing that what this medication is working for you is important, because some of your friends might be taking that for another disease, which might contradict your consciousness about it. When do you expect this medicine to start working? How will you know if it is working? If you have any side effects, what would you expect them to be? And what are the serious causes of these side effects? For example, the water pill. You might have some dizziness when you stand up because it might drop your blood pressure too low. You might have a fall, which is dangerous when you have that because of your low blood pressure and your body is adjusting to that. So knowing all these things will prepare you. For example, if you feel dizzy when you stand up from sitting position, you might hold on to something. You might tell your family to watch you when you're starting this medicine and for a few weeks to know what that feels like. So you will only know this when you ask about these side effects. Does this medications cause any problems with your other medications, other prescription medications? Does your blood pressure medicine interact with your heart condition medicine? Does your blood pressure medicine interact with your lung condition medicines? It's good to ask these questions. And of course, some of these might interact with your over-the-counter. Some of the medication that we might prescribe you make you sleepy, and if you're taking NyQuil once in a while, you might get more sleepy, which is not good. So if you would like to stop taking medicine, would you stop it abruptly? And is that safe? If anything, you guys can take this from this lecture. First thing is, do not stop any medication abruptly. Always talk to your physician or your nurse practitioner or PA, whoever you're working with for your primary care or any other disease, any other medical problem, definitely talk to them before stopping it. Because we will make a plan for you, and a lot of our medication should not be stopped abruptly. Most of our medication should not be stopped abruptly. We have to make a taper plan for you so that you don't experience a lot of side effects. Either we make taper plan or we replace it with something. If you need a refill, would you need a follow-up appointment? Some of our medications will not be covered by insurance if you do not do some blood work for us and make sure your kidneys are working fine, your electrolytes are not being affected by these medications. So we might need blood work before refilling the medicine, or seeing you in person, see how you're doing, and doing a physical exam on you, check your blood pressure and things like that before we prescribe another refill. Definitely ask these questions. The next thing is not just talking to your doctor when you're starting a new medication. It's important to ask some of the questions to your pharmacist when you went to pick up the medication. How would this affect when you're driving? How is this going to interact with your food? How much dosage of your medicine should you take? At what time do you want to take it? Is it multiple times a day? Is it once a day? There are some medicines that we might prescribe as needed, which means when you need it, and what is the need? That's a very good question to ask to your pharmacist, also your doctor. Example would be, like I was talking earlier, when you have cancer pain, it's very difficult to manage, and it's to be prescribed pretty strong narcotic medications to treat the cancer pain, and that sometimes we prescribe them as needed. So knowing that when you might be needing that medicine is a very important part of managing your pain. So good to know what that is. And if you forget your medication, what are the consequences? Sometimes if you have thyroid issues and we give you thyroid medicine to take every day in the morning to keep your thyroid levels normal. And if you did forget the medicine, what consequences? Is it something's going to happen if you miss it one day? If not, is it okay to take it again tomorrow? Those questions need to be asked with your pharmacist. Switching gears a little bit on what your prescription is going to look like. I assume a lot of us have taken prescription medications, and we know what this is going to look like. But this is an example for people who are on the audio call. This is a picture showing what the label on your prescription bottle is going to look like. On the top corner, you'll have the pharmacy's address and the name. And below that, you'll have your name and your date that filled the prescription. And then you'll have the prescription number under it. Then you will have the patient's name. The first name in the chart is going to be your doctor's name. The next name is going to be your name and your address. And the dosage of the medicine that you're going to take will be under it. And then how frequently are you going to take it? This is the most important part of your prescription label, so make sure you keep an eye on it. Is it your medicine? What is the dosage? Is it right? And is the frequency right? Does it match with your prescription that the doctor prescribed? And how many refills do you have, and when should you discard the medicine is on the bottom of the label. So I'm going to move forward with our third agenda today, which is talking about managing your medications. So a lot of us sometimes have a lot of medications, especially when we are getting older. The prescription bottles just become more and more, and we might have to take multiple medications to manage the chronic medical problems that we might have. And that is okay, because we have a lot of us who, as we progress in life, unfortunately get some medical conditions that are only going to be managed with medications. And taking help is going to prolong your life and have a meaningful quality of life to manage these medical conditions. So in order to manage, for example, you have 10 prescription medications and you want to manage them, and you also on top of that have as needed over the counter, and you take a couple of supplements. So now we have about 12 to 13 medications that we want to organize. As I talked about earlier, make a list and organize a file based on prescription, over-the-counter, and supplements in a list. Then sometimes it might be difficult to keep opening the bottles every single day when you have to take medications multiple times a day. This is when it's very useful to have a pill box. Everybody uses a pill box. There is no age cutoff for this. There's nothing anywhere written that you only use it as you get older. That's not true. Everybody uses it. I use it when I travel because it's comfortable for me. So using a pill box and managing a pill box is also an important component of your life. So since taking medications is a big component of your life as you have the more and more prescription medications, it is important to take help. So if you're unable to open the pill bottle for whatever reason, it's important to ask your caregivers or your family members to help you arrange this pill box. There are a lot of pill boxes out there, and I gave you an example here which shows how they're very easy to open, very easy to take the pills, and you can organize them based on the time of the day. So, and then a lot of us live with young kids or children, and it's difficult to, and then a lot of our family members might be having medical conditions like dementia or depression, and it's difficult for us to keep our medications out in the open because it's a safety issue. So definitely try to secure your medications when you're around family members. So securing them in bathroom cabinets or in a cabinet that's only for you is something important. As you go through your medications, it's important to have your expiration dates checked because sometimes you may run out of the expiration if the medication stops working. So keep that in mind. And if there is medications that are expired, you need to find a way to dispose them safely. One of the easiest way is to talk to your pharmacist. A lot of the pharmacies take the medications back and dispose them. Rush has a safe disposal area here in our hospital. So when you come to your doctor, you can bring your pills and they will guide you where to go. Some of the do's and don'ts when you're taking medications. Do ask for help. When you're having difficulty understanding your medications or taking your medications or swallowing your medication, there can be a number of reasons. Definitely ask for help. Do not stop them. Do take the right dose and do take them on the prescribed time. If you experience any problems, do report them to your prescribing provider or your family members who can reach out to them. Do not discontinue the medications abruptly and don't take the medications in dark. This is a very important part because you might be taking the wrong medicine. You might be taking a different dose. You might be taking 2-3 pills. Sometimes you don't know how, they're very small. You might not know how many pills were in your hand or in your mouth. So definitely keep the lights on and keep your glasses on when you're taking medication. And do not ever share your medications with others. This is a very important component. We tend to incline to help. We as humans, we have the tendency to help our neighbors, help our family. It's part of our value. When you see suffering or friends suffering, you would tend to help them out. Hey, take my medications. But it's very, very important to understand these medications and the dosages are prescribed specifically for you. They will only work for your body. There is a lot that goes on in our mind as physicians when we're prescribing this medicine for you in terms of safety. We understand a lot about pathophysiology, how the body works, how the brain works when we're prescribing you this medication. So definitely sharing them with others will only most likely cause harm to you and them. I have a lot of patients who come and ask me this question. And sometimes my parents ask me this question. So why do I need to take so many medications? I kind of touched it earlier when we were doing some of the slides, that as we get older, we have, as humans, as anybody, as even animals get this problem. We tend to have, bodies tend to slow down, bodies tend to develop, conditions and diseases. For example, your arteries get stiffer as you get older, and that leads to high blood pressure. Your arteries get clogged and you might develop heart conditions. You might get a heart attack and develop heart failure after that. Your lungs get accumulated if you have ever smoked in your life, or if you're in a polluted environment, or if you're working in an unsafe environment all your life and you didn't know about it. You might develop lung conditions. And some people, including me, were born with the asthma and things like that. That might keep staying in your life, and you might have to take medications to manage it. So the way I tell my patients, and I tell my family members to understand why am I taking so many medications, is it's essential to manage your chronic medical problems to have a purposeful quality of life as you go through your aging, right? And understanding that this is normal, understanding that everybody's body is different, everybody can develop any different kinds of medical conditions, accepting that and taking help from your physicians is the biggest component of how to stay ahead of managing these medical conditions. Sometimes some of our medical conditions are associated with weight, or it may change with your diet. So definitely when you're making some of your outside medication, health changes outside the medications, you need to talk to your doctor. So that might affect or cut down some of your medications. If you lose weight, your blood pressure might get better, your lungs might get a little bit better. So we might adjust some of those. The final component of our lecture today is a little bit about supplements. So when we eat a variety of healthy foods and balanced nutrition, that's the word for it, you get all the nutrients you need for your body. But sometimes as we get older, we might need additional support to take some dietary supplements to increase the nutrients in your body, because you might not be getting proper diet to assist you with all the nutrients. So that's where the supplements come into the picture. Extremely important for us to know the supplements. Everybody should know what they're taking. Learn about your supplements. Talk to your doctor. Talk to your pharmacist or a registered dietitian about what the supplement is and how it's going to affect your body. Always remember, safety is your priority. If any of these supplements interact with your other medications or medical conditions, if any of these supplements have a tendency to worsen your other medical conditions, it's extremely important for you to stay away from them. And the only way you would know is to learn about the supplement and talking to healthcare professionals. Like I said earlier, when you come to the clinic, bringing all your medication to the clinic is one point, and do not forget bringing your supplements. This happens a lot in my clinic, and I make it a point to ask my patients about, like, did you tell me about your supplements? What do you take? Bring them to me next time you come, because they might forget about it. So definitely don't forget to tell your doctor what you're taking. Patients and caregivers who can understand the science behind the supplements, it's very important to check FDA, which is the Food and Drug Administration, and USP is another organization that monitors the supplement area of supplement part. So checking the science is extremely important. It's good to know that all your prescriptions and all your over-the-counter medications, the first two parts are like of our list, are approved by FDA. While a lot of the supplements, maybe most of them, are not approved by FDA because FDA only approves medications that have a clear evidence or science to prove that it works on the body and it doesn't cause harm. The Food and Drug Administration, the FDA, is a very rigid component of our American healthcare. It only accepts or does not accept certain types of medications or food in general based on the data behind it. That's just how America works. That's just how our healthcare works. So when it's good to have like a conscious on why they're not being accepted by FDA, because we just don't have enough science to back up that this medication is good for you. Doesn't mean that these medications doesn't work or these supplements doesn't work. They might work. They might work for some person and they might cause harm for some person. We, as American healthcare, just don't have enough understanding of it. That's what you need to take from it. USP stamp is something you can look up, and it's important to know because this is a little bit regulated USP stamp on your supplements that will help you get a better gauge of if you have this stamp. These are a little bit more regulated than the supplements that do not have the stamp. So you just have a gauge about some checkpoint. Some of the common supplements, we might have heard about this and where these are found. Vitamin D, calcium, B12, and B6, and some of you might already been taking these supplements, or your doctors might be prescribing you vitamin D, vitamin B12. These are very common medications I prescribe as well for my patients. Just the dosages of them are the different from what you might get from over the counter versus what I would prescribe for you based on your levels, because we can check these levels in your blood. But these are the areas where you can get your supplements. Vitamin D mostly from milk products and fortified products. Calcium also found in most of the milk and fish, dark leaf vegetables, and some of the breakfast cereals are added fortified with calcium. B12. It's important to know that strict vegetarians and vegans have very high risk of developing B12 deficiency. The reason is natural B12 found in the nature is only reserved to animal foods. Doesn't mean anybody who's vegan will definitely develop B12. There are just different levels of how our body processes the supplement or the vitamins that we get from our food. Some are more risky. Some people might be more at risk of getting it versus some might not. They might be fine. B6 is another vitamin that's commonly found, and it's found in potatoes, bananas, chicken, and also fortified in some cereals. All this is found in your food. If you just don't have enough proper nutrition, you might have to add these to your supplement. There's another type of supplements that's very popular now called antioxidants. They're very popular, social media and just internet in general is talking about it a lot. So some of them are beta carotene. This is found in vegetables, fruits, carrots, dark vegetables, etc. Selenium is another mineral. It's a very critical mineral. It works in a lot of our enzymatic process in our body, and it's found in seafood, liver, meat, grains, rice, wheat, those kinds. So if you're eating any of the grains every day in your food, you just don't even need this, because overdosing on these is also dangerous. Vitamin C is very common. We use it. We take high dose sometimes. A lot of our patients do that when they have cold, things like that. Once in a while, it's okay, but taking them regularly, might have to think about it. Vitamin E is also found in a lot of seeds, oils, and wheat germ, things like that. And that is also common in food, and you don't have to support it. You don't have to add it another supplement into your body. Good to remember that none of these antioxidants are proven. Again, we talk science in our healthcare here, are proven to have any benefits on your chronic diseases. And some of the studies, they're even telling us now that it's causing more harm. So whatever the data, we may not have enough data, scientific data to support this, but whatever data we do have is telling us that if you take large doses of these, they might be harmful for you. So always important to check with your doctor, check with the dosages. There is no regulation for this, like the Food and Drug Administration don't have any authority and they're not regulating this. And they're not telling what's the maximum dose you can do. So there's so many out there. So bring your bottles, talk to your doctors about the dosages you're taking so we can at least adjust and tell you what's safe and what's not. And if you actually need them, or just forget about it. Now this is an additional important herbal supplements. This is just an example of few that I found online, but there are so many out there. Traditional Chinese medicine, traditional Indian medicine, Ayurvedic medicine, all this medicine fields. It's a different type of field than allopathic medicine, which is what we practice in America. They have their own mechanisms of treating diseases, and some of these herbal components or supplements come from that area of medical field, which not necessarily is proven to be wrong. But also, like I said, everything comes back to how much evidence, scientific data do we have to support taking this. Ginkgo biloba, ginseng, echinocacea, black cohosh. These are the things that I found, and they're very common. You can find them in any supplement store, sometimes even in the pharmacies. Then give there all these, tell you that this will help you with all these things. It's important to know they can also harm you. Some of these supplements actually prolong a lot of prolong like extra medications, prescription medications. They interact with your medications. So it's so important for you to talk about this and what dosage you're taking, whatever you're taking with your doctor. So you are not on prescription medication that's going to be affected by this. If you are taking a prescription medication that's going to be affected by ginseng or ginkgo, you should not be, you should quit. You should stop taking one of those based on your health. So again, coming back, we don't have enough scientific evidence to support this. And it's important to know that anything that says natural or that comes from the plants just does not mean it may be safe. There are poisonous plants out there. Anything in excess can cause you harm. We just need everything in smaller quantities in a composite way in our diet to help us, but taking more one and less another one will most likely cause more harm. So be aware of what's out there in the way taking your medications and supplements affect your body. I always tell my patients, especially my older adults, they know their body better than anyone else. They know how they feel. They know how they react and respond to whatever they put in their mouth or whatever they get into their head, right? Psychological part of it too. So it's extremely important to know that you are the hero of your life, and we are here to support you. Whatever you want to take, it's your choice. Always be mindful and understanding of your body and how you're responding to it, and take it step by step. That's exactly how I tell my patients, and I would encourage you to take ownership of your medications, take ownership of your health, learn the term called health literacy, and own your health. and take help with your doctors and pharmacists and your family members, dietitians, everybody around you to understand what's out there in America, what medication supplements out there that is going to affect your body. And with that, I would conclude my presentation. Thank you so much for giving me this opportunity to talk to you guys. And I'm happy to take any questions.
Thank you so much, Dr. Peraza. What a wonderful presentation. I love, owning your health. So I've learned a lot today to start to practice that a little more. Okay, so I'm sorry, go ahead.
I said, I appreciate you.
So any individuals over the phone that would like to ask a question or share a comment, you can do so by unmuting. You can press *6. Okay. So you will have another opportunity to speak at the end. So we're going to go over to our YouTube chat box. And one of our questions that we have, Dr. Peraza, is if you can talk a little bit about generic medication versus the brand name and its effectiveness.
So, I mean, the best way to think about is both of them have same active ingredient in it, same medication in it. Generic versus brand names is just another way of, I would like to look at it as a price reduction. A lot of our branded medications have upped the price a little bit more compared to the generic. One way to also look at it is when a new medication comes into the market. Let's say we were talking of example of blood pressure medication. New blood pressure medication comes into the market. They have to do, the pharmaceutical company has to do extreme amounts of research to provide enough data to the FDA to support that this is a clean medication, this is a safe medication, have limited side effects. That's how it comes to the market. So when initially pharmaceuticals bring the company, very big pharmaceuticals bring the medication to the market, it's only them who are prescribing it, who are providing it for a few years because they have a patent on it. So the patent is the reason why you have branded medications, but over a period of time, after 5 years or whatever number of years, which I'm not sure, depends on the medications, you will start having the generic common other companies also taking over to provide these medications for a lesser cost to everybody. So good to know that they are both same. Good to know that you need to focus only on the dosages of the medications and whatever is cheaper and available to you by your insurance.
Awesome. Thank you. And then we have another question as well, a general question. What advice would you give for persons interested in homeopathy?
Well, good question to ask me because I'm from India and I've grown around homeopathic medications and homeopathic doctors. One of my best friends is a homeopathic doctor in India now. Saying that, the way I look at it is I've grown up with Ayurvedic, Unani, homeopathic medications around me, but I have personally never taken them because I come from a family, both of my family members, my mom and dad are doctors, and they only practice allopathic medications or the evidence-based medications that we are doing in America, in India as well. So if you're really considering homeopathy or any other fields of medicine, you need to know that we just don't have enough scientific data to tell you that this is safe. First thing is that and a lot of the homeopathic medications do not work for a chronic medical condition. They might help you a little bit with your symptoms, like nausea, if you have, maybe that'll help you with that. Maybe a little bit of dizziness, sometimes that may help you. I look at it like sometimes symptoms, treatment-wise, you can help get better with that. But managing your chronic medical problems with something that doesn't have enough evidence behind it is just not advisable. And especially when you have an acute medical condition, like you get an infection, you get pneumonia, for example. I would definitely not rely on other fields of medicine to treat yourself acutely, that is like in the moment when you have the infection. Again, because we just don't know what the medications are going to do to you, how they're going to interact with your other medical problems.
Thank you. And we have another question. If you use diuretics long term, can it harm your kidneys?
Very good question. Yes, diuretics affect your kidneys, first thing, but there is no evidence saying that it will harm you if you use it linearly for years together. The reason why your doctors check your blood work every 6 months. When I put my patient on any diuretic medication, I check their blood work at least every 6 months, sometimes more frequently. Like I was saying, there is no data saying that when you take the diuretics for X number of years, you'll start having kidney problems. There's nothing like that. But acutely, like when you start your medication, your kidneys need to get adjusted to the diuretic medication because that's where the medicine works to affect your blood pressure. It works on your kidneys to affect the pathways there to change your blood pressure and your water levels in your body. So in the beginning, when you start it, we will check your blood work more frequently. And then over a period of time, we check it at least every 6 months to make sure whatever the medicine you're taking, the diuretic is not changing any alterations in your kidney. There is no way to tell that. If you have any effects on your kidney, it will happen in the beginning when you start it. And then doctor will say, okay, this is too much for your kidneys. We'll just change it to something else. But if you don't have it and you're over the period of time, if you develop chronic kidney disease or you develop something going on with the kidneys, we would definitely not blame it on the diuretics. There are other ways that your kidneys get. I think my train of thought was, yes, there is no evidence saying that this diuretics over a period of time will cause this, but you can develop medical kidney disease as you age from your blood pressure, diabetes, or anything else, and you might add on to it, and I can see how you can relate it to your diuretic medication, but I can assure you, if that's what's happening, we will definitely take care of it before it even happens.
Thank you. And then I just want to give a moment for those on the phone if they had any additional comments. Again, pressing *6 at this time. Okay, awesome. Well, thank you so much, Dr. Peraza, for coming and sharing with us on today. What a great presentation. And we're so honored to have you on today. So thank you so much.
Appreciate you, Dee. Thank you so much for the opportunity and the time and all the questions. Please feel free to reach out for anything else.
Thank you. And now let's talk a little bit about some of our upcoming programs. So we have Cancer Thriving and Surviving. Join us for a free 6-week supportive workshop for those who are both currently in cancer treatment or in remission. This group is facilitated by 2 trained leaders. It meets for 2.5 hours once a week for 7 weeks and focuses on increasing your ability to manage your health and maintain an active and full life. In this highly interactive workshop, you will learn techniques to deal with problems such as frustration, fatigue, pain, isolation, poor sleep, and living with uncertainty. Appropriate exercise for regaining and maintaining flexibility and endurance, and how to make decisions about treatment and complementary therapies. Communicating effectively with families, friends, and health professionals. Nutrition recommendations for those striving and surviving with cancer, setting priorities and strategies for maintaining healthy relationships. The next workshop will be held in person on Wednesdays, starting May 1st through June 5th from 9:30 until noon. We also have a Matter of Balance that's starting, an 8-week and 8-session workshop for individuals who have begun restricting their physical or social activity because of a fear of falling. The workshop utilizes problem solving, confidence building, and balance improving exercise and cognitive restructuring to help participants prevent falls, improve their balance, and regain the ability to do what is most important to them. The next workshop will be held in person at Rush on Thursdays starting May 2nd through June 20th from 10 a.m. to 12 p.m. The Stepping into Summer Health Fair on Wednesday, May 22nd. It will be held in the Rush Atrium building from 1 p.m. to 4:30 p.m., where you can join us on the dance floor for some Chicago style stepping and salsa. In addition to experienced stepping instructors providing classes throughout the day, this health fair will include numerous health screenings and tables of information on services to support your well-being from our community partners and providers. We also have From Isolation to Inspiration. Join us for our second annual Shaman Senior Voices Thought Leader Lecture. From Isolation to Inspiration, Jeremy Noble, Dr. Noble, author of Project Unlonely, Healing Our Crisis of Disconnection, will explore the epidemic of loneliness and social isolation among older adults and discuss how the arts can engage, inspire, empower, and connect us. It will be held on Thursday, May 23rd from 11 a.m. to 1 p.m. and offered in person as well as streamed virtually through our YouTube channel. Registration is required for in-person. Please call our 800 number 800-757-0202 for registration. And then we have Shaman Senior Voices. Our Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your physician and loved ones. Shaman Senior Voices wants to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and loved ones to know your goals and wishes and what matters most to you at aging.rush.edu/shaman/collaborate and connect or scan the QR code to record on a mobile device or smartphone. In our next lecture will be Skin Health Awareness. It will be held on Wednesday, May 8th, 2024 at 1 p.m. We thank you again for joining our workshop on today. If you have any questions, feel free to give us a call at 800-757-0202. Have a great day.